Thank you.
So, two legends are coming together. So, what is the genesis of the partnership?
So the genesis of the partnership is Dr. Niteen, who's my father, has been at the practice for 40 years now. I have seen him, putting a lot of blood, sweat, and tears into building the institution as it is. But the need for eye care is expanding day by day. So when I see, he's looking at 80, 100, 120 patients on a daily basis, it was very challenging to manage all of that. And within that, as we want to expand, it always helps to have, a good backbone or a good infrastructure to be able to scale up the hospital in a good way where patient gets the best treatment out of it. Within that, I used to work at Quadria Capital earlier, and my entire intent of getting into finance and private equity was to understand how we can use finance to help create better healthcare institutions. So whilst I was there, the thought was always in my mind. Uh, I'd heard of Dr. Velu from long back. I know he's a visionary in healthcare, enterprises. And then Abhishek and I always had a mentor-mentee relation. And then at some point we explored the idea as to how within Maharashtra can we be partners together. So it is actually a very partnership-driven model that we're going to be following. We will be taking the lead, and they will be our muscle and brain towards expanding into Maharashtra. And the core objective is going to be to provide better care to people going forward.
Excellent. So, what are the key offerings? What will be the key offerings at the
So we are
Maxivision, and what are the advanced eye care
Yeah.
treatments
So
you're going
up
to
until now, we have been a complete umbrella for eye care within our centers, and we will continue to do so going forward. From cataract, which is the most common eye-related disorder, to refractive issues, where Dr. Niteen is an expert, whether it is LASIK, whether it's lenticule-based procedures, or ICL for very high myop. We recently had a national level cricketer come in, a woman who had a power of -18, and she used to wear contact lenses while playing, but she came in, Dr. Niteen recognized her issues, we did an ICL procedure on her, and then she felt it's magic. So refractive is another area of expertise. Dr. Rohan, who's a retina specialist, he looks at all cases related to diabetic retinopathy, vitrectomy, etc. Glaucoma is the other area. Then we have Dr. Aditi, who's a cornea specialist. So all cornea related procedures, keratoconus related procedures she looks after. Apart from all of these, we also look at low vision aid for people where vision cannot be brought back, but can we use some sort of technology to help them in their day-to-day lives to feel less dependent on people. So we also focus on all of those things, and the routine eye checkups, as we've been discussing, that it's important to do that on a yearly basis, especially for people beyond the age of 40. For diabetic people, we have the routine eye checkups where we have very high-end diagnostic tools which help us identify underlying issues and causes and treat them properly. So as we grow and expand, we will continue to strengthen these centers, and as well as when we are looking at more centers, we will be bringing along all of the technology into those centers as well.
Wonderful. Mahendra Singh Dhoni being your brand ambassador, how do you think it's going to boost and help
MS.
your awareness?
So for us, it is a privilege to have him as a brand ambassador. He is a loved, celebrity
yes.
all over India and globally. What we've been saying that people need to have more awareness of eye-related disorders. When somebody like him speaks, a lot of people are listening.
Right.
So the intent is going to be to, have him address some of these key challenges, have people kind of understand that it is important to get their annual checkups done. If they are having diabetes, if they're having hypertension, to understand what are the other potential effects that could have on the eyes. Because just imagine if one doesn't have vision, not only are they handicapped themselves, they are unable to contribute to society. Their family members also, find it a little bit of a burden. But timely checking, timely, intervention can help address all of that. So having a brand ambassador like MS Dhoni, we would, really want for him to be able to speak on some of these causes and get, good outcome out of that.
Right. India being the capital of
Diabetic capital of the world. We have 20
It's very
crore
scary,
diabetic
yes.
people, and diabetic retinopathy affects 1 in 5, and nobody who's diabetic knows that. So it's important they do the yearly screening to identify, and then the doctors can help them manage these situations.
And kids are into gadgets these days.
Yeah.
So, what are your final words for them too?
So for children, it's an interesting time, right? Nobody has had as much screen exposure in the last 3-4 years as they would have had prior to that. I think the key over here is that they balance it out. If you've heard of the 80-20 rule,
Right.
that every 80 minutes of screen time, at least have some 20 minutes of looking elsewhere.
Yes.
Apart from that, we are in process of setting up myopia control clinics.
Okay.
These are addressed for children from the age of 3 to 10. There are certain contact lenses which can help protect their eyes from all of these blue radiations which come in from digital devices. So we will be speaking a lot more about that. The doctors, we have an active YouTube channel, so if people are following us on that, then they will be able to get more information. But the idea is to allow children to have a balanced lifestyle. More outdoor time is good. A healthy, balanced diet is very good. Yearly checkups is good, and managed screen time is good. If they do all of that, I think we'll be fine.
All right, wonderful. Thank you so much for sharing those insights.
Thank you so much.
Wish you good luck and have a bright future. Thank you.